Dementia. I am just so honored to be having these conversations about dementia and just the challenges that especially caregivers have. And of course, if you're new to this channel, then what we're doing is really just talking about um, dementia, the challenges, and especially for caregivers that have a very unique perspective of trying to navigate through helping their loved ones with dementia. And while we welcome conversation for all caregivers, we really do also really focus our messaging on minorities because we know that minorities do have some unique challenges other than some other demographics. So today, I am excited to be talking with Felicea, who is a licensed clinical social worker. And we're going to just be talking about one, why we want to have this conversation, why we need to really specifically talk about minorities and the challenges that are faced there, and just really kind of get into what we need to know as a community. So, Felicea, welcome to the conversation. Again, I introduced you, but feel free to talk a little bit about just yourself and what you do.
Well, thank you so much, Liletta, for having me on. I really appreciate it. And I am a licensed clinical social worker. I have a private practice, and I'm also opening a nonprofit mental health clinic for children, youth, and families in the Richmond Highway, Alexandria, Fairfax area. So again, to work with minorities and non-minorities. If you can't come together around mental health and wellness, what can you come together around, right?
Wow. So true. Wow. And congratulations too on opening up this very much needed thing for the community. So we're excited to hear more about that too as we go on. So of course, as I mentioned, we're talking about dementia, caregiving, and today we're really talking about the minority community. And Felicea, you know, when we were talking about what this conversation would be about, one of the things that I really wanted to highlight is why we need to have a conversation about this. I know in my experience, working in the community, I find that people tend to kind of have a one size fits all approach to dementia. Even my personal experience has been a challenge just trying to figure out, okay, what information do we get, what resources? If you watch the interview with Dr. Scott, she shared being a doctor in the profession, but then dealing with it with her mother. Again, it was just a completely different dynamic and things she had to learn, and she's in the business, right? So can you share more on that? Why do we need to really approach this differently?
Well, I think dementia is something that we weren't familiar with until real recently. And again, as humans, we're living longer. As African Americans, Latinos, Black and brown folks, we are in some ways living longer, but also our health is changing in some ways. So also as the baby boomers are ending and we're getting into the newer generations, those generations are being the caregivers of our parents. And with our parents living longer, that means that their brains may be deteriorating. So with all of that being said, it has been different for, I think, the Black and brown community, because anything around mental health, anything dealing with the brain, anything that seemed like a personality difference, we hid, we locked away. And now, thank goodness, I think there's been a lot of messaging, branding, and COVID in some ways really helped us with that. So we heard more about mental health and wellness, more about seeing a therapist, and more about what we could do to improve our lives.
Yeah.
when COVID was at its height. So
Yeah.
now we're able to have these, I think, really courageous conversations around our families and what
Yeah.
our families look like and what our families are dealing with.
Wow, I appreciate that. And, so many things that I've read and researched and different people I've talked to, you brought up COVID. you know, what I'm reading is that this pandemic really set every kind of developmental stage backwards. So, in your experience, have you noticed just this increase, kind of since the pandemic of just these type of, I guess we would call them mental illness? Is that even the appropriate terminology?
Yeah, it could be mental illness, mental health disease, mental illness disease, mental disease. It's whatever you feel comfortable with. But I think, yes, in a lot of ways. So to talk about dementia specifically, if you were a person who was already beginning to experience just a little disorientation, a little confusion, and then all of a sudden your entire world changed. The just the habitual things that you did. We go to the grocery store on Sunday after church. On Tuesday, we took the grandkids to piano, whatever it was. All those things that sort of grounded us
Mm.
stopped. So if you were already vulnerable around being clear with your schedule, the timing, what day it was, those temporal concepts, it was very offsetting to everyone. So, of course, to a person who had the beginnings, onset of dementia, and certainly if they had heightened levels of dementia, certainly it was very, very difficult. It was difficult for that person to grasp, and it was difficult for the families to be able to express what was going on. First of all, because we didn't know what was going on. We couldn't tell you when it was going to end. We couldn't tell you that it was getting better. And for a lot of our dementia clients, they went without needed medication. So because of COVID, remember, there was a time we weren't sure if we could even go outside in the air, let alone go to a doctor's office. So there are some treatment medications out there right now that can sort of slow down the progression of dementia, but you need to get it within a certain period of time. And in the height of COVID, we were only doing sheer emergencies, and those were typically around COVID.
Yeah. Wow. And I've shared this many times in talking about just the journey that we go through when there's a family member with dementia. And one of the challenges that I think is worth addressing, and why My Natural Me, my organization really is working hard to bring awareness, because as you mentioned, there is a bit of a difference now. So if you think about those baby boomers, like you said, they may be in their 70s, maybe early 80s, their offspring, their generation, are like 40s, maybe late 30s, 40s, 50s. And so now you have a very interesting dynamic going on. So, let's just kind of use a woman, so let's say a daughter is helping to take care of her mother who has dementia. So you have maybe a 40-something-year-old daughter who is dealing with what life brings around that stage, her own hormonal changes and just that stage of life. And then now dealing with a parent who's going through changes. And then we add the culture piece in there. And there again can be just really within all cultures, there's just different unique little nuances to all cultures. So I think I love, when we talked about doing this series and talking about this, you said, you cannot have a one size fits all, because we have such different experiences around it.
We do. Well, first of all, we have different experiences around how we view our parents, that idea that, some cultures, we still call our elders Miss and Mr.
Mm-hmm.
And we're not going to give them a directive.
Mm-hmm.
So it's really difficult when we have high regard and that respect and those places in our mind for our elders. And then it's our own parent that we would never say, we know better than to say something flippant, let alone disagree. And when we find ourselves in a situation where we're having to sort of take charge, we're having to parent, it feels very, very uncomfortable. And it almost feels like we are being, in some way, abusive to our parent. And that's where it's so helpful to have other family members, people that we trust, our church family, our community, people that we trust around us to assist us with this. Because, for example, when do we tell our mom or our dad, you know what, I think I'm going to hold your checkbook. I think it's best if I, as your daughter, hold your credit cards. I've seen times where a mom is sort of in and out. Mm-hmm. So at times she's very lucid, and that is part of this disease. You and I talked about it. It's like Swiss cheese, right?
Yes.
So you go through and it's like, she's great. She knows you're coming for lunch. She's ready for the weather. She's dressed. Everything is great. And then when you get there, she talks about how she gave $100 bill to the guy that just mowed the lawn. No one's mowed the lawn. It was snowing. Yeah. What did you give $100 to? So those types of things become either confrontational, which we certainly isn't going to help anybody. But that's where we have to, as the caregiver, say, this isn't making sense. Yeah. So what I can do is I can prevent from more of these situations happening.
Yeah. And, that's what I really hope is going to happen with this program, with people coming together and being able to share their experiences. Sometimes just knowing that you're not the only one, that in itself can just be so helpful, because you do feel somewhat isolated. And again, I can speak to my culture. And I'll say my culture, and even within the Black community, there can be layers and difference. But my experience, growing up very private, it's just been that kind of dynamic. Right. So, when my mom got diagnosed with dementia, and I talk about it, very public about it, it was a challenge, because how do I get the help? How do I talk to her? How do, we talk about it as a family? So those are some of the things that I'm excited about being able to bring to this program and to these group discussions that will be starting in March, because people need to just know, okay, I'm not alone. Someone else can relate to this.
Absolutely. And finding that community. I strongly suggest to people that as we start to caregive, even before any kind of major medical issues, as we start to look out for our parents more and more, making sure that they have a doctor that they trust and we trust. So that when something like this happens, we have communication and we can trust them. That's one of the things that happens oftentimes with dementia clients, is that they stop trusting those trusted people. So I had a client that said, I'm not going back to that doctor. That doctor's trying to put something in my body. I don't trust him. Yeah. So I said to the offspring, the child, the grown child, I said, is this someone brand new? And they said, it's horrible. Her doctor retired. We had to get a new one. We don't absolutely love him. He doesn't really speak to her, and she doesn't really trust him. That's a really hard place to be in. So being able to sort of prepare, not preparing for our parents to get sick, but to prepare to be able to support and care for them, no matter what. to be a part of that caring community that your parents have. And then, like you said, there are some things that are private, but privacy to a point.
Right. Yeah.
Mm-hmm.
Yeah.
I may not share with everybody, but I certainly can share with my family, my close friends. Yeah.
Yeah. And you need that. And one of the things that I've said recently, whenever I saw dementia, anything like on TV or anything, it typically is showing you kind of like the later stages. And so I think one of the things that's been one of the biggest challenges for myself and others that I've talked to, that longer stage when they're in the beginning stages. You don't typically see that and like I said, in a lot of shows and movies, but I think that can be one of the most challenges and challenging. And the one group that I went to, support group, there weren't really anyone that looked like me, in skin tone and in age bracket. But I do, we were having this conversation. There were probably like 50 people there, so it was well supported. But it was mostly older white women who were taking care of spouses that were in this particular group.
Yes.
But one of the things that was said, because I was still asking questions, and one lady said, that first stage is the longest and it's typically the hardest for them. Mm-hmm. The later stages are harder a lot of times for us because that's when it typically, the memories are really, really gone and they're kind of, going backwards. So it's hard for us as loved ones to see that. But she said they're kind of mentally a little bit gone at that point. So I thought that was interesting feedback because, it was kind of twofold. One, I felt it was a little harder to think, wow, is she suffering, But it was also interesting to know that, okay, you kind of have to decide how you want to look at it. So one way is to say, you know what? I still have this loved one. I get some good times in there. And even when they're confused or agitated, we can work through that, And of course, for me, I firmly believe people should go to therapy and like you said, have somewhere, whether it's your religious institution, group, somewhere where you can talk through the process. But I do like to just kind of share that. And I want to make sure people understand, because when it's first diagnosed, I think so many times people feel like I do, and they're like, what in the world? I did not know this was going to happen like this.
And it's interesting because different people, it's like anything else. You and I could both have a cold. You could be drinking tea at work and I could be at home completely in bed. So the way it progresses is individual.
Yeah.
However, there are some signs that we can look for. And some of those are those things like, all of a sudden she's saying something that doesn't quite make sense. And then she's back again, but this is the third time this week. It didn't make sense. So then you talk to a sibling, or you talk to, the ladies that she plays bridge with, or whoever, and find out that, yes, sometimes she says this, but we don't worry about it. So that's just an alert. It's just getting you prepared to wonder what's going on. Start thinking about things. Now, I heard what you said as far as the support groups. Sadly, we find this in so many areas, right? Especially dealing with health. We are very much underrepresented. And I would strongly encourage folks that are caregivers to start participating in groups, going on social media and making their own groups, but being really intentional about caring for and sharing how you're caring so that others can know, because it does feel different to have people who look like us talking about this. And it also feels different when there's a whole mix of people we're caring for. Like you said, it is typical to have a spouse, an older spouse, Typically, the man's older than the woman, so the woman is being the caregiver. But what we're seeing more and more now, especially with this generation, with the baby boomers, and then also, especially in our Black and Brown communities, is that the children are the caregivers of the parents. Now, they may also be parenting as well. They may also be navigating their careers or retirement or whatever. So there's a whole lot of other stuff going on. And just knowing that you're not the only one, finding out how others are navigating through that is so helpful.
Yeah. Wow. Well, Felicia, I know we could go on and on and on, and hopefully you will be back. I know we've talked about even when we start our support groups, guys, Felicia is going to be able to join some of those. You heard her busy schedule. So I don't know how many we'll get, but we will take whatever we can get because we really do need it.
I hope to. And I want to thank you so much for inviting me to this. I just think it's so important. This is one of those not talked about topics, and yet there are more of us out there who are caring for our parents than we know.
Yeah. Wow. Well, thank you so much for your time. And of course, if you're watching, definitely you can go to mynaturalme.org. You can email us at info@mynaturalme.info. Of course, it's right there on the screen because we are looking to connect people to get the resources, to get the information. But also, if you have resources, people have been reaching out to me since I announced that My Natural Me is doing this, and they want to support. They may have lost loved ones or have family members and all that. So we've had people volunteer to donate coloring books for caregivers and all of that. So we really appreciate it. Continue supporting. Definitely reach out if you just want to be a part of this. And with that, we'll see you next time. Thanks for tuning in.